Psychology is meant to help people understand their mind, emotions, and relationships. But not everything that circulates under the name of psychology is actually helpful, or even true. There's a lot of misleading information being repeated online, in self-help books, in therapy circles, and even in mainstream education. And this misinformation can lead to confusion, self-blame, broken relationships, or worse, it can delay real healing. If you've ever felt overwhelmed by the endless stream of psychology advice on the internet, please like this video, subscribe to the channel, and share it with someone who deserves clarity, not confusion, in their healing journey. Let's talk facts. Why is there so much misleading information in psychology? There are a few reasons. 1. Psychology has become popularized. What was once reserved for academic settings or clinical work is now everywhere, on TikTok, Instagram, YouTube, and podcasts. While this brings awareness, it also brings oversimplification. Complex ideas are squeezed into 15-second reels, and suddenly everyone's an expert. 2. Algorithms favor dramatic content. The more extreme the claim, the more views it gets. So terms like gaslighting, trauma, narcissist, and boundaries are often misused, because they trigger reactions, not because they're being used accurately. 3. Self-proclaimed experts. Many people speak confidently without any background in clinical psychology or counseling. Confidence is not the same as competence, and just because someone talks like a therapist doesn't mean they are one. Let's clear up some of the most common misleading ideas floating around. 1. Everyone you disagree with is not a narcissist. One of the most abused terms online is narcissist. Yes, narcissistic abuse is real. Yes, narcissistic personality disorder exists. But not every difficult, selfish, or rude person is a narcissist. Overusing the term makes it meaningless, and worse, it can lead to false accusations, unnecessary breakups, and a sense of victimhood that doesn't actually empower you. To diagnose NPD, a professional uses strict clinical criteria, not vibes, anger, or one argument. If you've seen these patterns and are tired of the psychological buzzwords being misused, go ahead and like this video, and if you haven't yet, subscribe, because clarity should never be a luxury. 2. Cutting off people is self-care. Not always, yes. Some relationships are toxic. Yes, sometimes going no contact is necessary, but the trend of cutting off everyone who disagrees with you or makes you uncomfortable is not always healthy. Some discomfort is a part of growth. Some difficult conversations build maturity. Walking away every time things get complicated might protect your ego, but it doesn't build emotional resilience. Boundaries are not walls, and healing is not the same as avoiding. 3. Your emotions are always valid, but they're not always accurate. This is a tricky one. Yes, your emotions matter. Yes, your experience is real, but feelings are not facts. You can feel abandoned and still not be abandoned. You can feel attacked and still not be in danger. You can feel unloved and still be deeply loved. Validating emotions is the first step. Challenging the beliefs behind them is the next. 4. Healing is not linear, but it's also not passive. Another misleading idea is that healing will happen automatically if you just feel your feelings. No, it won't. Healing takes active work. It means facing the truth. It means doing things that are uncomfortable. It means learning new skills and unlearning harmful behaviors. Sitting with your pain without direction might feel honest, but it's not always productive. Therapy isn't just crying, it's restructuring your inner world with intention. 5. Labels are not identities. Another dangerous trend is the over-identification with diagnoses and trauma labels. People say, I have anxiety, so I can't do that. I'm an empath, so I absorb everyone's pain. I'm neurodivergent, so I'm just like this. While self-understanding is important, labels should guide you, not define you. If the label becomes your personality, you risk staying stuck. You are not your diagnosis. You are not your trauma. You are not a permanent victim. 6. Not everything is trauma. Yes, trauma is real, but not every uncomfortable or painful event is trauma. Psychology today often lumps everything under trauma: breakups, job losses, criticism, childhood rules. It's easy to feel seen when we use the word trauma, but when everything becomes trauma, the word loses meaning. There's a difference between stress, adversity, emotional neglect, and trauma. Understanding the difference helps you respond with clarity, not confusion. 7. Not all therapists are equal. This is hard to say, but important. Just because someone is licensed doesn't mean they are trauma-informed, culturally aware, or emotionally mature. Some therapists project. Some therapists are passive. Some don't challenge you when they should. That's why self-education matters, so you don't blindly accept everything you're told, even in therapy. A good therapist won't tell you what to do. They'll help you think better, not think for you. 8. Your inner child needs everything. Not always, inner child. Healing is powerful. But it's not a free pass to stay emotionally immature. The goal is not to keep nursing your pain forever. The goal is to grow from it. The danger in overly nurturing your inner child is that it can keep you stuck in blame, helplessness, or entitlement. Sometimes the inner child doesn't need comfort. Sometimes it needs structure, and truth, and boundaries. So how do you protect yourself from misleading psychology? 1. Ask for sources. If someone says something dramatic, ask where the information comes from: a licensed psychologist, a peer-reviewed journal, or just a meme. 2. Check for extremes. True psychological insights usually allow for nuance. If someone is always using black and white thinking, they're toxic, you're perfect. It's likely oversimplified. 3. Test it in real life. Does the advice lead to more peace, better relationships, or greater maturity? Or does it lead to fear, blame, and isolation? 4. Don't worship experts. No one has all the answers, not even your therapist. Trust your instincts. Trust your lived experience. And be open to evolving. Final thoughts. Psychology is powerful. It can heal, it can awaken, it can transform, but only when it's honest, and balanced, and humble. Misleading psychology might feel validating for a moment, but long-term, it can leave you confused, bitter, and stuck. You deserve better than pop psychology. You deserve more than emotional clickbait. You deserve truth that sets you free, not binds you tighter. If this talk gave you clarity, please like the video, subscribe, and share it with someone who might be drowning in well-worded misinformation. You're not crazy, you're not broken, you just need truth, not trends. See you in the next one. Until then, stay thoughtful, stay grounded, and stay free.